evening, folks. We're going to go ahead and call the meeting to order. This is the mic you get. This one doesn't work. This is the one you get. Can you hear me okay?
Yes.
I'll put on the teacher voice if I have to. So with that, roll call by the county clerk.
We have 25 present and 5 absent.
All right, thank you. We have a quorum. Please rise for the Pledge of Allegiance. Supervisor Foster, would you lead us, please?
Sure. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Remain standing for a moment of quiet prayer meditation. Let's especially remember this is Law Enforcement Week. Thank you. You may be seated. Are we in compliance with the open meeting law?
We are.
Okay, does anybody have any changes to the agenda? Seeing none, we'll consider the agenda approved. Approval of the April 21st, 2026 meeting minutes. Supervisor Winnicky.
I would move approval of the April 21st meeting minutes as presented.
Second. Second, Jekyll. All right, all in favor, say aye.
Aye.
Opposed, the same sign. All right, thank you, folks. Okay, so we have some special orders of business tonight. So if I could have Kathy Colley come to the front, joined by Judge Deering. And I have a statement from Supervisor Nass. As the Jefferson County Board Chair, I do hereby appoint Kathy Colley of N3045 County Road J, Fort Atkinson, Wisconsin, 53538, to the vacant District 20 Supervisory District seat of the Jefferson County Board. I respectfully request board confirmation. Could I have a motion?
So moved.
Okay, and a second? Get all of those. Okay, so the motion was Supervisor Risto, and we'll go with Kennard for the second. All right, your turn, sir.
Supervisor appointee Colley, congratulations and thank you for your years of service in human services, and I wish you well in District 20. You ready to take your oath? Please raise your right hand and repeat after me. I state your name. Do solemnly swear that I will support the Constitution of the United States and the Constitution of the State of Wisconsin, and will faithfully and impartially discharge the duties of the office of County Board Supervisor to the best of my ability. So help me God. Congratulations, Supervisor.
Welcome. I say welcome back. For those of you that are new, Kathy faithfully served us for many years in human services, so we are excited to have experience joining us. Communications notice of public hearing for planning and zoning. No, sorry, EMS special education section.
Okay, thank you, everyone. Just bear with me for one moment while I try and share my screen. Yes, I'll be right back on. All right. I got one more request coming your way.
See it, all right. Okay. This is the first of a series of requested presentations, and I will share the reason why on EMS in Jefferson County. So what we're going to go through today is the history of why we're talking EMS, a snapshot of our current EMS system, an overview of the EMS working group and University Alliance, why the county is involved in the first place, and some recent state laws. So going into the history here. In January of 2020, the Wisconsin Policy Forum published a study that was requested by Jefferson County called Greater Than the Sum, a scan of municipal service sharing opportunities in Jefferson County. It involved a number of different recommendations, anywhere from shared dispatch services and police and law enforcement, highway services, inspections, many different things, but one of the more salient issues was EMS. So that report was issued in January 2020, and immediately the county requested a follow-up survey from the Policy Forum that was issued in October of 2020 called Taking the Pulse, which is a review of staffing and offering different policy recommendations for collaboration of EMS within Jefferson County. This was commissioned pre-COVID, was issued during the height of the COVID pandemic, and so it was somewhat put on a shelf as EMS dramatically changed in those couple of years. In the meantime, the system continued to face the problems that were beginning in the probably mid-2010s and were exacerbated by COVID. And so statewide, the state legislature also started to get involved in ways that municipal EMS services could and should be supported. And so in March of 2023, the Office of Rural Health through UW-Madison published a study called The Reliability of Wisconsin's 911 Ambulance Response that called out some stark realities statewide and led to some small changes within the Wisconsin state budget. From that Taking the Pulse survey, there were a number of recommendations, and I'll read through all of them. At a small-scale collaboration level was a recommendation for regular countywide meetings of EMS providers, joint training, joint legislative advocacy, a consolidated dispatch system, and joint quality and/or case management. At a sub-regional level, there was a request to create standardized operating procedures, allowing for patient transport services from other departments, cross-credentialing across departments to allow people to serve multiple different agencies, consolidating administrative and leadership functions across several departments, consolidating all dispatch at the county level, leveling the pay for paid on call and paid on premises across all departments, and moving towards shared full-time and part-time staff. There was also an analysis of what would look like with a county-supported EMS system, which would include hiring an EMS coordinator, coordinating and staffing an EMS council, and providing supplemental financial support to municipal EMS providers. Remember, this was published in October of 2020. They also identified certain things that would be future challenges for Taking the Pulse. Some of these things have changed, however, many of them remain the same. They predicted that staffing would continue to be an issue, that paid on call and paid on premises models have been dwindling in recent years. They cited specifically, and I quote, inadequate pay, difference in hourly wages, and a longer quote, strong incentive for people in the workforce to not consider EMS as a profession or had to leave the profession for jobs that support a higher standard of living and less stress. Some of this is also due to the increasing burden of hours of training requirements that are necessary to maintain licensure. They also identified that future challenges might be consistency and quality of care, that there is a lack of consistency in response times, that at that point there were 6 medical directors providing direction to the 12 EMS agencies, and again, the skill maintenance, licensing, and training issue. They also called out that coverage during busy times and for higher call volumes would be an issue in the future. They identified a shrinking roster of volunteers, the difficulties presented by mutual aid, and that call volumes were expected to increase due to our demographic changes and an expected aging population. They also identified that fragmented dispatch, mutual aid, and the hesitancy towards regionalization would continue to be challenges. So that report was issued October 2020. As I mentioned, I came to the county in July of 23. So what happened between July of 20 and May of 2023 is really unknown to me, but some of you might remember there was probably not a lot of talk going on about EMS at that point. But in 2024, there was ongoing discussions with the mayors and city managers, administrators at the regularly scheduled municipal update meetings that we have. At one of our legislative breakfasts, every single town that was here identified EMS as their top priority. And so Ben Waymeyer at the time, me and Steve Nass went around to regional town meetings at all of our 16 towns. We combined about 3 or 4 at a time and had a series of them throughout the summer of 2024. And similar themes began to emerge, that they have issues with contracts, contract negotiation, and communication with some of the providers they contract with, that funding is an issue, that maps and boundaries are an issue, fairness between different areas is an issue, how this all interplays with fire services, and also a request to create a EMS working group, as has been called out in the beginning. So what does EMS look like in Jefferson County? There are 13 different agencies. You'll see the map on the left is the district territories of the 13 agencies. Those are Cambridge EMS, Edgerton EMS, Fort Atkinson EMS, Ixonia, Jefferson, Johnson Creek, Palmyra, Ryan Brothers, which is covering from a contract on Lake Mills, Waterloo, Watertown, Western Lakes, which is kind of a consolidation of most of western Waukesha County and parts of eastern Jefferson County, and Whitewater EMS. Those are our 13 different agencies, and again, the maps are what you'll see on the left. On the right is an exercise that Supervisor Degner asked our mapping department through GIS to put together, which is a 6-mile radius from each district headquarters. And so you'll see some overlapping circles. For the most part, everyone in Jefferson County lives within 6 miles of an EMS station. But not everyone does. And I saw Supervisor Turville Heights just point to herself, because she must live in that town of Oakland that is one of these areas that a circle does not touch. So what have we found out about some of the EMS data? I'm not going to go through all of it now, but we did have a researcher come in and create a Power BI dashboard that pulled all the 2024 NIFRS data and created a searchable database for us to see the spread of incidents and also filter them in different ways. So for instance, we can look at the call volume and incidents by month and a heat map of where these came in. We can look at incidents by time of day. We can look at transports and the type of care, whether it was ALS, AEMT, or paramedic, or a BLS call, whether critical care was provided, what the transport looked like. So all of this is now data that we have available to us because of the EMS working group. And who is the EMS working group, you might ask? Well, it is a group of 13 individuals that were appointed by the county board chair at the direction of the county board. There was a resolution adopted in 2024 or early 2025 to create this group. It involves one medical director, that's Dr. Chris Wistrom from Mercy Health, the sheriff, 2 members of MABUS 118s, that's the Mutual Aid Box Alarm System Division 118, which serves Jefferson County, and Bruce Peterson, who is the Fort Atkinson Fire Chief and also the vice chair of the EMS working group, and then Ron Wagner, who is the Jefferson Chief and the head of Division 118. We have 2 county board supervisors on it, Bruce Degner and Dwayne Morris. We also have 3 representatives from towns, Kim Cheney from the town of Kashanong, our own John Kennard, who represents the town of Sullivan, and Laura Payne for the town of Oakland. And finally, 4 municipal representatives. So Drake Daly from Lake Mills, Kyle Ellison from Johnson Creek, once again our own Jenny Quimby from Waterloo, and Tanya Rainen, who is the Watertown Fire Chief. They meet monthly on the second Wednesday of every month from 9 to 11 in this room. So those that are on the EMS working group and the county board have nice back-to-back meetings. But how this is funded is the city of Waterloo worked collaboratively with us to apply for a state innovation planning grant. There was a $3 million grant program available from the state of Wisconsin, only to municipalities of under 5,000 people, to look at different ways to consolidate and coordinate among local governments. Waterloo put in for the grant, received it, and then signed an intergovernmental agreement with the county to fund the EMS working group. We have a consultant from the University Alliance who coordinates the research groups and attends all of our EMS working group meetings. And in collaboration with the chair and vice chair, University Alliance created a survey to find out about what the priorities this group should examine. And that's what you'll see on this slide. The yellow ones are short-term goals, red ones are longer-term goals or stretch goals, and the green ones are potential goals to explore. This was published early on in the meetings, so about a year ago, and some things we have looked at and some things we have thrown off. But basically, the group was looking at ways to improve operational consistency and coordination, funding and financial sustainability, and service quality and sustainability. I'd be happy to share all these with you. University Alliance, I've said their name a couple times. They were funded, like I said, in part by the Innovation Planning Grant. They are a group out of UW-Madison, and they connect the EMS working group with student researchers on a variety of topics to support these identified goals. There's one project lead, her name is Megan McBride, and we so far have had 6 student groups over 2 semesters examining different areas of the EMS system. So in fall 2025, we had a public health group exploring emergency medical services models for Jefferson County, looking at different ways that other counties might support EMS. Visualizing EMS call data in Jefferson County, that was the independent study that showed the Powered BI dashboard that I shared. And then also exploring opportunities and challenges for a countywide EMS billing system in support of one of the goals that we were trying to look at, unified billing. This past semester, we've had 3 groups. One, exploring the feasibility and other examples of a countywide unified funding system. This would be a model where we would potentially say no more town EMS contracts. The county is going to come in and fund all EMS with payments, kind of coordinating the payments directly from different areas of government. One, understanding the true cost of EMS and developing countywide funding formulas. This is a way to say if the county is going to fund EMS, what might be a equitable way to do so. And then finally, identifying countywide systems efficiencies and opportunities for cost savings. So, why is the county even involved in the first place? I will get to later on in a future one of these updates on what other counties are doing. But many counties, if they are not already, are looking at using a line of statute that exists for basically a very targeted purpose like this. There is an exception in Chapter 66 of the statutes for when a municipality or other local government can exceed the levy limit. One of those exceptions, of about 10 of them, is to support municipal library operations. And we do that already in Jefferson County. If you look at, remember, we have budget deliberations, things like that. We levy for the library separately because we are using a separate levy limit exemption to do so. Of those 10 exemptions, one other one is for a county-wide EMS system. And there's really no other guidance beyond what that looks like. So there is a narrow exemption under state law where the EMS working group is now saying if we're looking at a lack of funding available to municipalities and individual departments are not able to exceed the levy limit, should the county step in and exceed the levy limit to support municipal EMS operations in order to create a sustainable EMS system countywide? I will dive much deeper into this in a future update, but I do want to leave you with this because I think it's important, is that levying beyond the levy limit means we are charging higher property taxes. That is just going to say levy limit because it's the easier way to do it, but it does include a vote to increase property taxes if that were something that was going to be done. There are trade-offs that the EMS work group has looked at, which is if the county raises levy by X amount, departments have to lower by Y amount. However, the EMS working group has consistently made the argument that we are not suffering from a system where resources are allocated incorrectly. We are suffering from a system where we have too few resources. So like I said, the state has started to pay attention to some of these things. There have been some various proposals, some funding assistance program to allow for different capital purchases rolled out in recent years. This past year, there have been a couple bipartisan bills signed into law by the governor. In October of 2025, he signed 2 bills into law, Act 35, which creates a tuition reimbursement program. It allows for people to sponsor, basically potential employees, to go through and get a higher level of EMS training. And on the back end, it provides funding for technical colleges to provide scholarships and other tuition reimbursement and other grant programs to set these trainings up. That funding was actually just released by the Finance Committee by a vote today. Act 36 was another way to try and get some departments some more money, and it increases the Medicaid reimbursement rate for non-transport EMS calls. So if you'll recall this map early on, of all these incidences, the larger bubbles are usually ones where they are senior living facilities or other areas where you're not necessarily needing to transport to a hospital, but you're getting calls for lift assists and maybe some other things. So this new bill that was signed into law is looking to maybe pump some more money into the system that way through the Medicaid rate. Just about a month ago, the governor signed into law Act 212, which allows a group of municipalities to form a qualified district for EMS services, and then allows the members of that district to do what we're contemplating here, which is exceeding the levy limit for EMS costs. This is a game changer, and it's something that the EMS working group is going to talk about at their May meeting. There are certain things that make this more difficult. There have to be 8 whole municipalities or 232 square miles of territory that pass a referendum every 5 years to continue in this district. And so there are certain layers of bureaucracy, but it might be an option that the EMS working group wants to look at. So that's where I stand right now with this. I promise future updates. This was recommended by the EMS working group. The executive committee approved that this format of me kind of going over at the beginning of each meeting some information on EMS so that you're all informed as to what is going on, particularly if there is any type of vote on the county involving itself in EMS. So there will be a similar update for EMS at each meeting from May through September. Some of the future topics that I'm working on, what are other counties doing, a deeper dive into the library model, looking at the operational limitations of the fire and EMS departments as they exist today, additional ideas from the EMS working group, and any trade-offs that the county board might like to see of our EMS systems on the back end. So I welcome any feedback that you might have on those. I guess I would be open to taking maybe 1 or 2 questions if there are, but otherwise we can keep the meeting moving along. Yes.
Do we have access to the Power BI dashboard?
Yes, we are trying to migrate it to something where you don't need a Power BI subscription to view it, but we will be able to let you play around with that database as much as you want. So yeah, we'll get that. Yes.
Are there going to be, how are you thinking about addressing where people who live more than 10 minutes from a station?
So something that we've talked about is the creation of some type of like satellite station or coordination of staging ambulances in different areas when maybe one is called out to address mutual aid. We've talked about close to responding units. So if someone's traveling through an I-94 on the way back from a hospital, do they get the call rather than routing it to maybe the originating district? So I think to address that, the best way of, we've also talked about paramedic intercepts and staging those in different areas too. So I think the best way would be if we were to add additional staff, including those staff in satellite locations. The problem with that is that almost everyone nowadays is cross-trained fire and paramedic. And so if you're staging a firefighter way out in the town of Hebron, they're not gonna be able to respond to a fire that might happen in Fort Atkinson. And the Fort Atkinson taxpayers who support that system might say, wait a second, what are we doing paying for a firefighter to be sitting on the town of Hebron? And that is why an additional reason for the county's involvement, which is I tried to say from the very beginning of this EMS working group, why would a citizen in, say, in the city of Jefferson voluntarily raise their own taxes to make sure that I-94 has adequate EMS coverage? It doesn't make any sense. The county, though, has that different incentive mechanism, and it might be a different calculation for all of you as county board supervisors to look at a system where we're really trying to say that everyone within the county should have access to EMS service in a fair way. So, yes.
Assuming the county would, if it went into it, would be able to set a levy sufficient to take care of all the problems to start with, what's the levy cap after that? Are you stuck with that number? Is it same levy cap operation, or is that just outside the limit?
It's just outside the limit. Under Act 212, it's a one-time increase with a 2% plus CPI escalator. Under the existing levy limit, under Chapter 66 for the county, it's literally just the cost of a countywide EMS system. And that's the only guidance they give. Yeah, one more question, yep.
Yeah, and does that mean that people who are paying now through their taxes to their municipalities would see those dollars go down if the county is raising, or is that not going to happen?
That is a policy decision of the county board to make. The EMS working group would like to say no. Base level taxes and the county would levy on top of that. There is nothing to say that you could not say, okay, we're gonna support a countywide EMS system, meaning we're gonna levy on all the county taxpayers X amount, and then you must, as a condition of accepting this funding, reduce your levy by Y amount. That certainly could be added. So,
All right, thank you very much, and we'll hear about this each month. So that way we have an idea what's going on when it comes time to vote on it at the very end. Okay, number 8, communications. We have 2, should be in your packet. Notice of public hearing, planning and zoning, May 21st, 2026, 7 p.m. And the treasurer's monthly report should be in there. Public comment. Do we have any public comment related to agenda items? Okay, I guess we don't. All right, up now are committee reports, resolutions, and ordinances. From the executive committee, we have a proclamation and a resolution. Supervisor Winnicky.
Okay, this would be proclamation 2026, number 1. Thanking the first responders at the April 23rd fire in the town of Palmyra. Whereas a large structure fire was reported on April 23rd in the town of Palmyra, rising to a 5th alarm level of the MABUS box alarm system. And whereas there were responses from many agencies who sent engines, trucks, tenders, squads, ambulances, chiefs, special equipment, or other assistance to help contain the fire to one building and extinguish it even under challenging conditions. And whereas responding agencies included Burlington, Cambridge, City of Beloit, City of Waukesha, Clyman, Lowell, Reesville, Darien, East Troy, Elkhorn, Fontana, Fort Atkinson, Heartland, Helenville, Ixonia, Jefferson, Kettle Moraine, LaGrange, Lake Country, Lake Geneva, Lake Mills, Lakeside, Lebanon, Lyons, MABUS Division 102 from Racine County, MABUS Division 115 from Dane County, Merton, McWanago, Palmyra, Rome, Sullivan, Test Corners, Town of Delavan, Troy Center, Vernon, Village of Waukesha, Waterloo, Watertown, Western Lakes, Wheatland, and Whitewater. And whereas interagency cooperation and the willing assistance from these agencies in multiple counties help protect life and property, now therefore it be it proclaimed that the Jefferson County Board of Supervisors thanks the first responders for their efforts in this and every emergency response within Jefferson County. Mr. Chair, I move approval of this proclamation.
Second. Mr. Jaco. Any discussion? All in favor, say aye.
Aye.
Opposed, the same sign. All right, thank you. If you see any of these folks, be sure you say thank you to them. And resolution number 2026, number 7.
Accepting bids for the access platform to the courthouse rooftop. Executive summary, Jefferson County Courthouse has several mechanical items on roof section Q that have chilled water conduits and ductwork obstructing proper maintenance access to air handlers and cooling towers. The corrective action for this matter is to fabricate and install a metal access platform and stairs to aid the maintenance staff and contractors to safely navigate a path over the obstructions. On February 25th, the Director of Facilities issued a request for proposal, or RFP, to solicit bids for the access platform to the courthouse rooftop. 2 bids were received. The low bidder is Quality Erectors and Sheeters in the amount of $48,562. The Director of Facilities checked references to ensure this bidder would be able to perform the work as required and has received positive responses. This resolution accepts the bid of Quality Erectors and Sheeters and authorizes the county administrator to execute a contract as specified in the bid documents. Executive Committee considered this resolution on April 29th, 2026, and recommended 4-0 to forward it to the county board for approval. Mr. Chair, I move approval.
Second. Jaco, just so you know, this project was included in the budget, so it's not a budget amendment. So all we need is a voice vote. All in favor say aye.
Aye.
Opposed, the same sign. All right, thank you, folks. We now move on to the Finance Committee, Resolution 2026, number 8. Supervisor Jaco.
Thank you, Mr. Chairman. 9, claim for damages by Alexandria O'Brien. A claim has been made against Jefferson County for damages. The claim has been reviewed by the county's insurance carrier, WMIC, and was recommended for disallowance based on the finding that the county has no liability for this claim and is not legally responsible for the alleged damages. This resolution formally denies the claim filed against Jefferson County and directs Corporation Counsel to give the claimant notice of disallowance. The Finance Committee considered this resolution on May 5th, 2026 and recommended forwarding it to the county board for approval. Fiscal note. This matter has been referred to Wisconsin Municipal Mutual Insurance Company, WMIC, and will be resolved in accordance with the terms of the county's policy. Mr. Chair, I move for approval of this resolution.
Second. Trina. Any discussion? All in favor say aye.
Aye.
Opposed, the same sign. All right, thank you, folks. Passes. Number 12 is Planning and Zoning Committee. And just so you know, they haven't officially met in the new series of elections. So I'm going to call on Supervisor Jakel, who was past chairman, until they get a chance to elect there. So Supervisor Jakel, ordinance number 2.
Thank you. Report to the honorable members of Jefferson County Board of Supervisors. Jefferson County Planning and Zoning Committee, having considered petitions to amend the official zoning map of Jefferson County, filed for public hearing held on March 26th and April 16th, 2026, as required by law pursuant to Wisconsin statutes. Notice thereof having been given and being duly advised of the wishes of the town boards and persons in the areas affected, hereby makes the following recommendations. The committee has reviewed and considered the facts presented in the application and received in public hearing, and finds that the criteria listed in Wisconsin Statute 91.48 and Jefferson County Zoning Ordinance Section 2256B have been met for the below listed petitions. The committee further finds that the petitions are consistent with Jefferson County Comprehensive Plan and Preservation Plan, and it's for further support of the committee's recommendations can be found in the staff reports and the individual file petitions in Record and Planning Development Office. Approval of petitions as listed, dated this 12th day of May 2026, Blaine Paulson, Secretary. With that, the ordinance is number 2026-2 to amend the official zoning map. I move it as printed, and there is no fiscal cost at this time. I move for approval of the ordinance.
Second. Okay, second. Okay. Any discussion? Mr. Kennard?
I will abstain for a potential conflict of interest.
Thank you. Noted. Any others? All in favor say aye.
Aye.
Opposed, the same sign. Thank you. All right. Now we have 2 sets of appointments. There's appointments made by the county administrator and one by the county board chair. So we're going to start with the appointments by the county administrator.
Thank you. By virtue of the authority vested in me under sections 5915(2)B of the Wisconsin statutes, I respectfully request confirmation of the following appointments as listed in your packet below. I will note that I realize the zoning board of adjustment, which at the bottom actually does not need reappointment. So it would be those from Blue Spring Lake Management District through Traffic Safety Commission.
Do I have a motion?
So moved.
Okay. And a second?
Second.
All right. Any discussion? Hearing none, all in favor of the administrator's appointment say aye.
Aye.
Opposed, the same sign. All right, thank you. Now, this is appointments by the County Board Chair. I, Steve Nass, Chair of the County Board of Supervisors, Jefferson County, Wisconsin, as the appointing authority for the standing committees, hereby appoint the following. Do I have a motion? Okay, a motion and a second?
Second.
All right, now, note, they're all listed here, but the ones that have an asterisk do require board approval. We're just going to approve them. So Economic Development Consortium, Historic Site Preservation Council, Local Emergency Planning Committee, and Property Assessed Clean Energy Commission, and the Wisconsin Counties Utility Tax Association. So we have a motion and a second. Any discussion? Hearing none. All in favor say aye.
Aye.
Opposed,
Aye.
same sign. All right, thank you. Any public comment of a general nature? Any announcements? Supervisor Callen.
Just wanted to remind people that tomorrow from 3 to 6 is the electronics recycling event at the Fair Park. I handed out the brochures at our last meeting. The fee is just $10 per vehicle, and you can bring electronics and appliances without any extra charge. I do recommend that people get there before 6 o'clock, because it's likely we'll have to close the gates. If there's a lot of demand, we close the gates so that everybody can get through by 6 o'clock. So entrance is off of Spangler Road, and bring your stuff so it doesn't end up in the ditch. Thanks.
All right, thank you. Supervisor Gulick.
I have an announcement as well. Want to make people aware that the Brew with a View schedule is out and about. The first Brew with a View is on May 28th, featuring the group I Drank with Hank. That ain't worth the price of admission, which is none. I don't know what is. There's no cover. There's free parking. Other dates are June 25th, June 23rd, and August 27th. Brew with a View does a great job at supporting Jeffco Parks, and it's just a wonderful evening. For those of you that haven't been, make an opportunity to go out and visit.
All right,
Thank
thank you. Any others? Okay, Michael?
There are 2 blood drives happening this month. There's a sign outside the courthouse. I can't remember which one is happening which, but there is one on the 14th. And then tomorrow, that's here, tomorrow is the Law Enforcement Memorial Ceremony at the lawn right outside the Veterans Memorial statue, honoring all officers who have died in the line of duty, including the 2 in Jefferson County. So that's 11:30 on the lawn tomorrow.
Okay, thank you. Any others? Okay, I'm wondering if Supervisor Kaiser would like to introduce our supervisor in training and future president that you have with you tonight.
This is the reason why I ran. So this is your future president, apparently. He's embarrassed.
Okay, thank you. Thank you for coming tonight. All right, with that, I will entertain a motion to
So
adjourn. Okay, and a second, it does not require. All in favor say aye.
Aye.
You cannot say no. I don't know why you would, but thank you for coming tonight, folks.
Give him a couple weeks.
Mine will probably be messed up next time.
So, did you ever get involved or?
This one opted in and out several times. We didn't know what it was doing.
What it was gonna cost.
Because it was in budget.
And the bad thing was,
That's why I was.
the courthouse went out.
But usually.
Hang it in there.
It wasn't good.
I said I started my own one.
Oh, I gotta use my normal.
That's what I thought.
So the problem was. Safety ladder and some of that stuff. To do any of that. And it was trying to make it.
Help me out. I could do that.
My whole life there.
I know. Sign it.
Not that you don't look like a guy that would want to help me out either. Is it not that you don't look like a guy that would want to help me out either?
Shot I did on 13 last week when we were sitting there. Fourth one of the day. All three of them before that were over the trapping in, so I dumped it right in the trap.
That is golf. That is golf. You have it one day, you go to sleep, you wake up the next day. So happy.
What's going on? Yeah, sir.
Thank you very much, greatly appreciate it.
Yep, well, we got everything, all the irrigation set up, so we haven't had to use the drone, but
Sound bad.
that's, late nights, really mornings, water. Tonight, maybe I can sleep through the night.
They would never.